I'm Dan Drake. This is Visitor Network TV. Our guest is David Worth, who is an island native who went off and did a lot of things and has come back and is giving a lot of time and service to the town, which is great. Member of the Finance Committee and most recently chair of a committee to look at our island home. What was your charge?
Well, the charge came from the Board of Selectmen about September-ish last year, and it really was an outgrowth of the fact that the island home has been running deficits, which the taxpayers make up usually at an appropriation every town meeting. And it's run, those deficits have been relatively minor. To some years they're in excess of $3 million. So the charge was, what do we do? Is there anything that can be done so that we could reduce those taxpayer subsidies?
Isn't it a related question whether the town should be in the nursing home business?
That is definitely a related question. Nantucket is one of only 2 towns in Massachusetts that have skilled nursing facilities that belong to the town. There are other states where municipal or governmental ownership of skilled nursing facilities is fairly common, New Jersey and New York being a couple of examples, but in Massachusetts there are only 2 left. The secondary charge was, is there something that we could do with Sherburne Commons so that we could sort of blend the services that are being offered at Sherburne Commons with the skilled nursing facility. So that was a secondary
Well,
issue.
let's come back to that and talk about sort of your deliberations and where you came out.
Sure. So we had a committee that it was a great committee. It was very well balanced. We had Rachel Cretion and Pam Merriam from the town who were involved with our island home, selectmen representatives, as well as others who are involved with social services, care to, and services to the elderly. So we had a great group of people. We did a couple of things. We wanted to make this what I'll call a data-driven analysis. So it wasn't 8 or 10 people sitting around giving opinions, but we wanted to really back up whatever we were going to come up with some good data and good facts. So in that regard, we reached out to Peter Morrison, who's a local individual who's a demographer by training, who helped us really understand the very obvious trend of us baby boomers aging and what kind of services we might need in the future. And then we were fortunate to have the gentleman who runs the Taunton Skilled Nursing Facility, the only other municipally run facility in Massachusetts, in Taunton, come on a cold February day to spend the day and do benchmarking with us so that we had some good data there. In addition, there's a lot of information that's available about how skilled nursing facilities operate. So with that as sort of the baseline, we started to deliberate. And there are a couple of things actually over the months that became pretty apparent. One is that the physical condition of our island home, a facility that's about 34, 35 years old, is clearly beginning to show its wear and tear. The care there is absolutely excellent. The staff is fabulous in terms of the care, but they're increasingly having to deliver it in a facility that is, it clearly needs some help.
Like the hospital.
Like the hospital. And what's important about that is that while the state does inspections of the facility every year, the island home never has any deficiencies around care, but we're now starting to see deficiencies written up around the condition of the building, such that if the town doesn't address them, it could be in for financial sanctions or just prohibition about accepting any more residents. So that was a big issue that was associated with what are we going to do in the future. The second was that we did look at, should the town get out of the business. I had some conversations with people in the private sector who buy and operate facilities, and they were all very interested in the real estate that sits there, but the reality is that skilled nursing facilities only break even at about 100 to 110 beds. So it's from a private operation, it's a tough business.
How many beds does our island home have?
Our island home has 45 or 46 beds. So we're half the size that you would generally need.
And there really isn't the demand for the
Well, that's the other part of it, and that's why the conversation with Peter Morrison was important, because one of the dilemmas, and this is sort of the third dilemma we had, was what is the demand? We know that the baby boomers are aging, it's a big demographic, but is the demand going to be satisfied, through an expanded skilled nursing facility? Or are people going to look for ways to stay in their own homes, age in place as it's referred to? And we'll get to that because that's an important part of what we considered. But the demand side is important because we could, recommend to the town that we just build a new facility at the same size. We could recommend we build a facility twice the size. But in many ways, that's sort of the field of dreams. If they build it, will they come? And we wanted
Sherburne
to...
Commons, certainly, for a variety of reasons.
We have that example where that was perhaps not the best strategy.
They built and people didn't come.
That's correct. So we wanted to avoid. That. So we had sort of these confluences, and then on the cost side, there are two trends that are really pretty important. The reimbursement schedules that are coming from the federal government are declining. So they are reimbursing less and less dollars per bed day than they were a couple of years ago. And that data is available from the federal government, so you can absolutely see their trend lines going out into the future. So we knew that the reimbursement schedules weren't going to get any better. And then the second part of it is that we do have a cost differential here relative to other Northeast skilled nursing facilities in high-cost areas. So it's more expensive to deliver the labor here on Nantucket. So we never saw or could not project when those two would come together. Cost was always going to be increasing and reimbursements were going to be declining. So not a sustainable situation. So, that was another factor that, that came into our deliberations.
So what are the solutions that you recommended?
Well,
or at least the areas to explore.
Sure. Well, the first area is to have we do believe we have to do something about the physical condition of our island home. So what we have recommended is, and this will, I think, culminate with some options to come to annual town meeting in the spring is what we're aiming for. But the first is to move to a new style of skilled nursing facility, which has become quite common, which are called greenhouse facilities or more modular, smaller residential units. So that would allow us, we think, if we did that, to scale with demand. So these units typically have about 12 people in them, and they're served.
Would these be clustered, or would they?
They would be clustered because we have to think about delivering meals and laundry and all of what I would call the infrastructure of running a facility. But the advantage of thinking that way is that, if demand were 24 beds, then we could structure the demand that way. And if demand grew over time, you could add modules without going out and saying, should we build a 100-bed facility, for example, and then sitting with half of it empty. But that really requires that we do something either with Sherburne Commons or the hospital, because we see one of the cost-saving opportunities is to blend the infrastructure, the dining, the laundry, the facilities management, not the care, but the stuff that you don't see that's behind the scenes, but which adds significant amount of cost. In our analysis, we actually did look at the total cost to deliver those kinds of facilities between our island home and Sherburne Commons. And, we're talking in excess of $1.5 million. Now, that's not all going to go away, but there are opportunities to combine some of those, we think. So we think that part of the solution is we have to do something with the hospital or with Sherburne Commons, and that the third option is obviously the town could go on its own, but that's probably a less desirable option. So that's number one. The second is when we started looking at where reimbursements were going to come from the federal government. And what's important here is that about 68% of the revenue coming into Ireland Home comes through Medicare and Medicaid services, mostly Medicaid. And there is a decline in projected expenditures from the Center for Medicaid Services away from institutional settings like our island home and into home health care or community-based care.
And the greenhouse concept that you described a minute ago falls in the institutional care
In the
bucket.
institutional
Okay.
care, in the institutional bucket. Because, quite frankly, we're not going to get away from having the need to provide some institutional care. Not all of us can, stay in our homes, ad infinitum.